Does every patient with dengue infection require hospitalization, or can the patient be managed at home? This is the most important question when anyone gets diagnosed with dengue infection. So hello friends, I am Dr. Piyush Chaudhari, bringing to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases. Now in this video, we are going to discuss that after being diagnosed with dengue infection, which patients need to be hospitalized immediately and which patients can be safely observed or treated on OPD basis or at home. At the same time, amongst the patients whom we are treating on OPD basis or at home care, what are the warning signs which tell us that a particular patient is likely to go into a complication of dengue and hence needs to be admitted? So to understand this concept, we need to see what are the different phases of dengue infection and what are the different types of severity in a dengue infection patient. So talking of phases of infection, we have three phases. The febrile phase, which starts around 2 to 3 days after the infection sets in a person's body and lasts up to days 6 to 7. The critical phase, in which 5 to 10% of febrile patients enter, and this is the phase where various capillary leak, vasculopathy, coagulopathy or organ system dysfunction related complications of dengue can occur. And third phase, which occurs either directly from febrile phase or when the patients in critical phase are treated appropriately, is the recovery phase. During this phase, most of the symptoms related to dengue infection start to recover. The patient gets a sense of well-being, the appetite is back, and patient starts feeling energetic again. Similarly, talking of different severities of dengue infection, we can classify dengue infection into mild, moderate and severe disease. Now, in the mild disease, the patient just has the typical symptoms of dengue like high grade fever, arthralgia, headache, myalgia, retroorbital pain or pain behind the eyes, nausea, mild vomiting, slight abdominal discomfort with or without the typical dengue related rash and drop in WBC and platelet. The moderate group, this is the most important group, can be of patients who have all or some of these symptoms with either the risk factors for developing complications of dengue or the warning signs for indicating that the complications are already developing in the person's body. So what are these risk factors for complicated dengue infection or severe dengue infection? So these risk factors, most importantly, is somebody who is having infection for the second time. So as we saw in one of our previous videos, that anyone who gets dengue for more than once is more likely to get complications because of antibody mediated enhancement. Secondly, people at more than 65 years of age or children below 10 years of age, and especially if they have any degree of malnutrition. Third, pregnant ladies. Fourth, patients with any chronic medical comorbidities like diabetes, hypertension, chronic lung, liver, heart or kidney related diseases. Hematological diseases like hemoglobinopathies, platelet disorders or G6PD deficiency. At the same time, GI diseases like peptic ulcer disease. All these are risk factors which can lead to complications of dengue infection in that particular patient. So this is the group which should be very vigilantly monitored for the warning signs. Now what are these warning signs? The first and foremost and most important warning sign is postural dizziness. So whenever a dengue patient is developing hemoconcentration, which is because of leakage of fluid from the vascular compartment into the third space. So from blood, the fluid seeps through the small tiny capillaries of blood vessels into third spaces. So there can be fluid accumulation around the lungs, there can be fluid accumulation around the abdominal cavity, or there can be swelling of face, fingers and feet. So due to this, the blood pressure can drop, and this is a warning sign towards the patient going into dengue shock. So typically if the patient gets up from the sleeping position and sits or stands, within 2 to 5 minutes, if the patient develops dizziness or a feeling of blackout or as if the person is about to fall, so this is one of the warning signs when the patient has to be immediately hospitalized for proper fluid management, without which the patient can land up in dengue shock syndrome. Now about dengue hemorrhagic fever, the warning signs could be observing typical petechial rashes. Now these are tiny red, rounded and flat spots which are most commonly observed on the inner aspect of the elbows, around the ankles and at the top of the mouth over the palate. Now especially when we talk of inner aspect of elbows, these spots may be noticed once we inflate the blood pressure cuff when we are checking the person's blood pressure and keep it inflated for 2 to 3 minutes, and if more than 10 to 20 spots develop in the area below the cuff within 2 to 3 inch area, then that is one of the warning signs that the patient is likely to go into dengue hemorrhagic fever or dengue shock phase. Other than these two important signs, the other warning signs include feeling of excessive lethargy, restlessness, or altered sensorium or altered behavior in terms of irrelevant talking, excessive sleepiness, or feeling very drowsy, which could be because of the brain related complications of dengue, or symptoms like excessive vomiting preventing the patient from taking adequate oral intake. Then can also lead to complications like acidosis, or if there is severe abdominal pain and especially a tenderness on the right side of the abdomen due to enlargement of liver more than 2 centimeters. Along with this, if on clinical examination the person has evidence of excessive fluid accumulation in third spaces, so moderate to severe pleural effusion, moderate ascites, or severe edema of face, hands and feet, this can also be considered as a warning sign. Along with this, in the blood test related parameters, when we do a test called complete blood counts or complete hemogram, which all of you know that we have to do in a patient with dengue fever, in this, if the parameter of hematocrit or packed cell volume, this is rapidly increasing by more than 20% from baseline or more than 45% as the absolute value, then this indicates that there is what we call as hemoconcentration, which is again because of leaking of fluid from vascular volume into third space through capillary leak. Along with this, if there is rapid drop in platelet count, then that is also one of the warning signs. So anyone who has risk factors with or without warning sign, or anyone irrespective of risk factor but having one of the warning signs, has to be hospitalized in dengue infection. So friends, if you found this video useful, please do like it and share it with as many people as possible. And also don't forget to subscribe to the YouTube channel of Fever Care Center for Infectious Diseases, where we get public awareness videos related to various diseases, mainly related to infectious diseases. Because always remember, stay informed to stay healthy.